Hi, today we will be talking about rotator cuff tears. All you athletes, weekend warriors out there, I know you've either had rotator cuff tears or you have feared having one before. Rotator cuff tears usually present as gradually worsening shoulder pain or severe pain and weakness after a fall. And usually anyone after the age of 40, if they fall and can't raise their arm, it's a rotator cuff tear until proven otherwise. And usually the pain is on the outer part of the shoulder, not up here, but literally right here in the deltoid area. If someone comes in saying that they're having shoulder pain that wakes them up at night, I'm often very concerned about a full thickness rotator cuff tear. The pathophysiology can be trauma or repetitive overhead activity. Pre-existing bone spurs in that area can increase your risk of tearing, especially if you were to sustain a trauma such as a fall or motor vehicle accident. The exam consists of looking at the range of motion, strength, and then certain signs that we look for to see whether or not someone's rotator cuff is torn. X-rays can be helpful in identifying the bone morphology or those bone spurs that could have caused the rotator cuff tear. And then MRI with contrast is the best modality for identifying a full thickness rotator cuff tear, because when you inject the dye into the shoulder, it expands everything, allowing us to see the rotator cuff more clearly. The treatment is anti-inflammatory medications, cortisone injections, and therapy in partial rotator cuff tears. But if there is a full thickness tear, the recommendation is to proceed with surgical intervention immediately. Recent literature has shown PRP, plasma-rich platelets, which is drawing your own blood and taking out the section of the blood that is rich in growth factors, can help in partial tears. So that's what I've been using in limited cases in my office. And then finally, if you were to think that you may have a rotator cuff tear, taking over-the-counter anti-inflammatories for a week or two, doing stretching exercises is what I would recommend. But if you suspect that you may have a full tear, inability to raise your arm, or pain that wakes you up at night, I would recommend immediate consultation. And I would definitely not recommend a cortisone injection in the setting of a full thickness tear, because studies have shown that cortisone injections in the setting of full thickness tears actually prevent healing when you do in fact undergo surgery. So if there is a full tear, please seek medical attention immediately. This is Jonathan Lopez. He's my medical assistant. He's going to help me demonstrate the rotator cuff tear exam. So again, similar to shoulder impingement, what I do is I push in the area where I know that the rotator cuff attaches and often tears from, which is the greater tuberosity. So if I push here, those patients will complain of pain, okay? And then when I ask them to do range of motion exercises, if they have a full thickness tear, and I ask him to actively lift your arm, Jonathan. See, Jonathan can lift his arm, so I know he does not have a full thickness tear. But in patients who have a full thickness tear, even though they try to lift their arm, they can't. But you can have patients who have compensated for a full tear, especially if they've had it for a long time. So what I do is I would actually test their strength. So to test the supraspinatus, which is the one that is most commonly torn, what I ask them is to put their thumb down and then lift it out this way. And then I push against them. Jonathan will resist me. See, Jonathan is able to resist me, but if he had a full tear, he would be in pain. You can look at his face and know that he's in pain, and a lot of times he just can't, and the arm falls down. So those are the ways that I am able to test the rotator cuff, and then that's the supraspinatus. And then the infraspinatus and the subscapularis are less often torn. The supraspinatus is in the top, so that's how you test it. The infraspinatus is in the back, and that helps in external rotation. So what I would do is have Jonathan externally rotate against me, And if the inverse band was torn, he couldn't do that, or he would be in a lot of pain. And then internal rotation is subscapularis, and if the subscapularis was torn, again, he would be in a lot of pain or not able to resist me. So those are the basics of testing a patient who you suspect of having a rotator cuff tear. If you are feeling any of these symptoms currently and you need to come in to see me, please go online and book your appointment at Peachtree Orthopedics. Thank you.